Get my jewelry back on. Always feels weird not having a wedding band. I notice that's something the men do. We fiddle with our finger where it used to be. We're gonna give laying down a shot right now. I'm trying to get my neck in a good spot. When I sleep, I'm going to do something where I play with the sheets and towels to elevate certain parts and maybe lay a whole spread out. So if I want to lay on my side, I'll have a pillow like right here. If I want to lay on my back, I'll have a different one on the other side. Ooh, that actually feels nice. I haven't been able to lay on my back like this in 4 months. Man. You want to be able to sleep. You got to prioritize your sleep, no matter how fussy you got to be about it. Talk to your doctor and pharmacist about the drugs you have. Get the pillows set up, get the sound, get the lighting, whatever. The more you sleep, the better you're recovering. That above literally anything else. More than the physical therapy, more than the medicine, more than the diet, you gotta sleep. We're doing the 6-week skip along with day 1. If you hear some of my speaking is a little bit better. I always had a little bit of a lisp. I have a big fat tongue, but a lot of it with all the surgery, everything from the drugs wearing off, I'll speak a little bit clearer. And as this, especially the numbing here, returns to normal, it'll sound a little bit differently. The first few videos, you'll tell it sounds like I almost have something in my mouth when I'm speaking. Sleeping has gotten way, way better. It's comfortable. I look forward to it every night. It's weird, the pillow I use still changes every couple of weeks. Sometimes I want something a little thicker, sometimes a little smaller, sometimes softer, sometimes harder. So the way I set it up, have a big pillow on one end, a smaller one on one end, and then like a towel or sheet in between the two. So every half section of pillow is a different elevation, if that makes sense. So based on what you need to do, where you need to be to get comfortable. In physical therapy, they talk about how you should be resting and how everything should be relaxed. They'll stuff a pillow under a hip here to make your leg from turning out like that. They'll do certain things for your elbows and arms so it's propped up, your neck. If you've ever done CPR, they talk about how you are supposed to tuck your chin, to tuck somebody's chin when they're getting CPR. Think about that when you're getting your pillows set. So you shouldn't be here and you shouldn't be all the way up like that. Workout today was jumping rope at the end, and that was really exciting because it's on the turf. It's something I did not think I'd be able to do again, and just taking these baby steps like that is a big deal for me. So I'm excited about that. We're going to actually try hitting the punching bag the next day. And there's certain things they did when I took martial arts training, how they explain to minimize the impact. So you could spar with somebody, or if you don't have pads, the way you're supposed to hit somebody is a lot different. And I'll get into that a little bit tomorrow. But having done this today, I'm pretty sure I could do that. So again, we're looking at what's a little win that I could have. Well, I could do this now. I could do this. Be very cognizant of, I go up the steps easier. I don't have knee pain when I do this. I tried this for the first time. I went up a little bit quicker than I would normally. I have less brain fog. These pants fit a little bit better. And there was a place I was at, the chiropractor place I trained under that I mentioned before. They had a challenge, getting your pants challenge. That was always pretty neat. Him and his wife ran this really clever idea. to where you have a pair of pants, you have it out, you're trying to fit back in it, and I mean, just a play on words, people got a kick out of it. But they broke it down in a way that I always thought was really clever. Like, okay, I could get the pants on, I could zip the pants up, I could button it and it's uncomfortable, and then you actually fit. You notice these steps along the way with something that doesn't fit. So when you could think breaking something down like that, any goal you have, if you could break your goal down, it's way easier to stay motivated. You're way more likely to be successful. Reading about that right now in my psychology classes. So whatever your goal is, have your intermediate end game. This is what I want to do. I want to fit my pants. It has to be moderately challenging. It can't be too hard. It can't be too easy. So if you're a 36, it's not like, I want to be a 30 waist again. Well, guess what? That might never happen again, no matter what you do for an entire year. As we age, our bodies are different. If you want to get back down one pant size, that's more realistic. That's something that takes a moderate commitment, moderate amount of time, effort, and break that into the goals, like the example with the pants. So it's not just the neck recovery. It's not just an athlete. It's not just injury. We're trying to have things pointed out. You can relate to this style of thinking, this training, this journey that I'm trying to take. And hopefully it helps you. So whatever you're working on, working through, hang in there.